My guest today is someone whose name you might recognize, especially if you followed national conversations around COVID, public health, or vaccines. Dr. Amesh Adalja is a senior scholar at the Johns Hopkins Center for Health Security, a leading expert on infectious diseases, and he's from right here in Western PA. He's been one of the clearest voices in science communication over the last few years. And today we're talking about where things stand with vaccines, public trust in health systems, and what we need to be paying attention to moving forward. Hello, and welcome to this season of Alter Ego. I am your host, Laura Crago. Let's keep the conversation going. Welcome, Dr. Adalja. Thank you so much for making time for me today. You were in Butler today at the hospital. So talking about the current state of vaccinations and public health, I know for me personally, I am always looking for information. And, how would you describe the current public sentiment towards vaccines in 2025? So both the COVID-19 and beyond, and are we at a crossroads with vaccine confidence?
I think the way that the public views vaccines in 2025 is very different than they viewed vaccines in even 1995. What we've seen is basically a major erosion in the way the public views vaccines in terms of the value that they provide to the individual who gets vaccinated. People don't understand how vaccines actually are part of kind of civilization, the way that we are able to live our lives on a planet that has lots of infectious disease threats. People lost that appreciation. I think this was already something that had been eroding. COVID accelerated that erosion, and there's always been a small proportion of the population from the very first vaccine in the late 1700s that have been opposed to vaccines. It's just become something that has grown, and now it has a lot of political winds behind it, and that's made it all the more dangerous. And to me, I think of it as the sort of the voice of the Dark Ages, because it was Dark Ages mentalities that opposed vaccines, that you shouldn't interfere with what the natural order of things are. The first, even a precursor to vaccines was called variolation, which is a whole different story. But people said that to do that or to modify an infectious disease was to defy providence. And you're starting to see that now in 2025, which to me is mind-boggling, because to anybody who looks, they can see the fact that we're living in 2025. Our grandparents had to deal with measles and mumps and had their friends die of certain infectious diseases. And we had the luxury not to have those, but they're coming back because it was the vaccines that were the wall against these microorganisms, these threats. And I think people really took them for granted, don't understand how they work, and they think of them as some kind of political thing rather than actually a tool that you use to navigate a world in which there's many infectious disease threats.
We've seen a rise in vaccine-preventable diseases like measles reemerging in parts of the U.S. What factors are driving this?
Well, during COVID-19, there was lots of disruptions in healthcare. So some children didn't stay on the routine vaccination schedule. So those slipped. That's one thing. But what really happened, and we've seen this afterwards, is that they didn't get back on the schedule, and the number of parents who are asking for exemptions, who are not getting their children vaccinated, has increased disproportionately after the pandemic. So what happened was that there was vaccine hesitancy against COVID-19, and that basically bled into many other vaccines, including measles, including whooping cough, even including vaccines for dogs. Those rates are down. So what you've seen is people thinking of vaccines as unessential, something that they don't need. And then what really makes it dangerous is people's position on vaccine is now kind of seen as a way to signify what political tribe they belong to. Mm-hmm. And when something gets sucked into politics and becomes tribal, then all rationality goes out the window. And it's just your way of signaling that I'm part of this group or I'm not part of this group. And that's what's happened with vaccines, just like it's happened with many other things that we do in our day-to-day life. And when politics gets involved with infectious disease response, you get what we had during COVID with over 1 million people dead.
But how has the politicization of vaccines evolved since the pandemic, and what consequences is it having on routine immunization schedules and public health? I feel like you just answered that, and it's true that a lot of people that I know in particular believe that the government is driving the vaccines to almost keep us sick in a way. They think that they're trying to keep us sick. So politicizing that is something that I've actually seen an uptick in 2025. I feel like you answered that question, honestly.
But there's one thing I would add.
Yeah.
So when you look at the anti-vaccine movement, in the past, it was a phenomenon of the far left. So when I would give lectures about the anti-vaccine movement in 2018, I would pick on Marin County, California, which is just across the bay from San Francisco. That's where the anti-vaccine hotspots were, or places in Washington State or Oregon. Very, very blue states. And when I say who has the best vaccination rates, I would pick West Virginia and Mississippi, two of the reddest states, which had the highest childhood vaccination rates, had the least amount of exemptions for school entry requirements. But what happened was COVID-19 flipped that. So now it's not a phenomenon of the far left any longer. It's a phenomenon of conservative Republicans. And I think that's really ironic because it's different. It's completely different because it was this idea that vaccines were unnatural, that this was back to nature, and it was kind of the granola culture that was anti-vaccine. That's now switched to the MAGA culture being anti-vaccine. And there are people that took advantage of this. So RFK Jr. is a creature of the far left, an environmental lawyer who is now a creature of the far right. And I think that's just really, speaks to how things have kind of flipped. And the other part that's really, I think, ironic and sad is that the signature achievement of the first Trump administration was Operation Warp Speed, which got us vaccines in record time, something that President Trump deserves credit for. Yet he can't take that credit, and he has to go the other way because his tribe is against the vaccine. So all of this, to me, is kind of throwing things upside down.
Yeah.
But it really speaks to the fact that people the anti-vaccine movement has always looked at vaccines as a political issue, and now that's bled from the far left into the far right, and now we have, a much more difficult time trying to illustrate to people or concretize to people how a vaccine improves their individual life. And I think that's the bad part of it, because, as I said earlier, vaccines are tools for dealing with a planet that has lots of infectious disease threats, and you should kind of embrace those new technologies when they come out. I think of them as, when the new iPhone comes out every year or so, I run to get it. That's how you should really think about vaccines, that these are technologies that make your life better. And I think that that's really lost on people. And I think in many parts of the developed world, like the United States, we have kind of devalued vaccines. But in many parts of the world, vaccines are still something that people will stand in line overnight to get, just the way we stand in line to get an iPhone.
That's such an interesting perspective, and one that people need to hear. Why do you think they flip-flop so easily? Last time I spoke to you on the phone, we spoke briefly on the phone, you did mention that, how it has switched political parties. How is it that Trump has switched so quickly, and how has RFK switched? Like, what was it that caused that? Is it just because they believe what the Republican Party is telling them?
So I think what happened during COVID is there were many restrictions that people were not used to or were unprepared for, and some of them that were overly blunt in terms of shutting everything down, or schools being closed for a very long period of time, certain businesses being deemed essential and non-essential. The people were wary of the control that government was exerting during this public health emergency. And in the midst of that, the COVID vaccines came out. And it became something where government was promoting it, saying, this is our way out of the pandemic. And that, I think, kind of struck a chord with many people who were fed up with the restrictions that were in place because of COVID-19. And this was seen as another obligation the government was placing on the population. So what happened is that kind of triggered this rebellious streak that is kind of inherent in almost every American, that they're not going to be told what to do. And they were being told to get the vaccine. They were being told you have to wear a mask. You're being told you can't go to in-person school. So that got swept up into there. And that's how I think the Republican base became anti-vaccine, was because they lumped it together with all of the other restrictions. And we can talk about that, but those restrictions aren't things that I necessarily always supported. There was a lot of bad decision-making going on and overly broad policies put into place rather than targeted policies. So I think partially public health is to blame for the fact that we saw this anti-vaccine sentiment rise in a different political tribe. But it really has to do with the fact that this all happened during COVID. Initially, that vaccine hesitancy, people thought it would just be restricted to COVID vaccines. But and for the most part, the COVID vaccines are still the vaccines that people have the most hesitancy towards. But you see now drops in influenza vaccines, pertussis vaccines, MMR, as we've talked about. So it is something that's now spread to all vaccines.
So I did just ask you about the mRNA technology. There's growing skepticism around that, despite its success. So what would you say to people who are still wary of it, and where do you see mRNA vaccines heading next?
I think that mRNA vaccines are probably the most exciting thing that has happened in the vaccine world in at least 50 years. They are a very elegant solution to one of the problems that we had with vaccine development, that it takes a very long time, that it's really hard to change the formulation of a vaccine. In mRNA, by just taking the genetic material that you're trying to have some type of response to, the genetic material of a pathogen or a part of a microbe that you want to be able to generate an antibody to, being able to do that kind of by just reading off its genetic signature is, I think, one of the greatest achievements in vaccinology, and that's why it won the Nobel Prize. So I think that what we'll see is more applications of mRNA vaccine technology, not only in infectious disease, but also in personalized cancer vaccines. There's going to be a major revolution that's going to be built on mRNA. And mRNA, because you can make an mRNA vaccine so fast, it changes the way we think about infectious disease emergencies or pandemics. We can get something very, very quickly. There was a movie that came out several years ago called Contagion. And in Contagion, I thought it was unrealistic because before the credits roll, they have a vaccine. We can now do that with mRNA vaccines. So to me, the fact that they're not being embraced really, again, is another one of the phenomena that I think, that I call this mentality of the dark ages, where they think mRNA is too new or too fancy or too hard to explain, so somehow it must be bad. Whereas mRNA has been something that's been studied for decades. This was a technology that was poised to really show its worth, and the pandemic provided that opportunity, and the mRNA vaccines performed incredibly, saved countless lives. And the fact that they were available within 1 year is I think, the most astonishing aspect of it all, because that allowed so many more lives to have been saved versus if they would have come out 2 years or 4 years or whatever it might have been. And I think that, so I think that when there's this antagonism towards it, I think of it as, the antagonism to Galileo or the antagonism to Darwin, that this is not something based on the actual science of mRNA. It's based on misinformation, including misinformation now that comes from RFK Jr. and some of his underlings at the Department of Health and Human Services. And what it's doing is it's going to really stunt the ability to use mRNA to its full potential, which in the end is going to make it's going to limit human potential or limit our ability to flourish. And I think that's the evil part of it. I think it's really nihilistic to take a technology that's so powerful, that's so beneficial, and then spread misinformation, spread lies to try and devalue it, to try and smear it in the minds of Americans. That to me is, as I said, evil. I think it really involves evasion of what everybody's senses can tell them, that these vaccines save lives. I can remember even here in Butler in the early days of the pandemic, and back in 2020, 2021, when the vaccine became available, it changed how we were dealing with COVID. It gave us a way out of it, and we almost immediately started to see a decline in severity in those people who were getting vaccinated. And I think it's so when people don't believe in the efficacy of the vaccine, I think it really involves kind of this willingness to not look, a refusal to look, a refusal to deal with the facts. And I think that to me is exactly what you would have seen during the Inquisition and the Dark Ages, and people just not wanting to believe something because even despite the evidence in front of their senses.
Yeah, absolutely. You've had over 10 years of experience, right, with RFK, as far as like having conversations or even him avoiding having conversations where you're present. Do you want to talk a little bit more about that over the 10-year span, right, of time that you've sort of...
It's probably longer than that now. So I guess I've been doing media and public speaking about infectious disease at least since 2007.
Okay.
And throughout that time, I've had to contend with the anti-vaccine movement, primarily as a phenomenon of the far left, and especially, for example, during the Disneyland measles outbreak that occurred in 2014. That was a time when there was a lot of anti-vaccine sentiment coming primarily from the left at that time, whereas and the right was kind of ridiculing the left over this Disneyland outbreak. How things have changed since then. But so since around that time, I've been trying to speak out about the value of vaccines and trying to understand the anti-vaccine movement and giving people historical context. Because when Edward Jenner made the first vaccine against smallpox in the 1790s, he was met by the anti-vaccine movement. That's when the anti-vaccine movement began, is with the first vaccine. And it's morphed throughout the ages, and it really got accelerated in the 1980s. And then exploded in the 1990s with Andrew Wakefield's fraudulent studies relating to autism. And even though those studies have been completely debunked, Andrew Wakefield has lost his medical license. It was shown that trial lawyers were involved in financing that study, and there was a major financial incentive to blame the MMR vaccines for autism. It's taken on a life of its own. It's something that still is in people's minds. We continue to spend millions of dollars to debunk a fraudulent study. And I think you think about all the research that wasn't done because we had to push research money towards trying to prove a negative over and over again. And I think that individuals like RFK Jr. came up through that movement or capitalized on that movement and have become, icons of it. Chief propagandists is what I say. That they push that propaganda at every chance that they have. And that the anti-vaccine movement is now more powerful than it's ever been before because now they have government power behind their false message. The most powerful health official in the United States is one of their own. Mm-hmm. And they're installing more of them everywhere. And I think it's making it harder and harder if you're a vaccine developer to think this is a good industry to be in, because what you're going to be met with is multiple obstacles and roadblocks, many of them artificial, just making it harder to be a vaccine developer. And if you're a vaccine developer, you might say, well, or if you're a biotech or a pharmaceutical company, you might say, why would I even go into vaccines? Why would I make vaccines when I can make cancer drugs or drugs against cardiovascular disease where I don't have this controversy? Because vaccines are not a big moneymaker. That's another myth that the anti-vaccine movement spreads, that vaccines, these big profits from these big evil pharma companies, that's false. Vaccines are not profitable. They're not something that that pharmaceutical companies usually want to do, but when they can invest in more lucrative things. So I think what we will see is we'll start to see companies exit the vaccine space. Mm-hmm. And that, again, will be something that makes us all worse off.
Mm. The COVID, now an epidemic or endemic. What does a smart vaccination strategy look like? So annual boosters, targeted rollout, or something more adaptive? When we're looking at something like that, we're 5 years in. So
I've been someone that's always thought that COVID vaccines need to be targeted, especially when we're talking about additional doses. So when you think about what our COVID vaccines do right now, the primary benefit is prevention of severe disease, prevention of hospitalization, prevention of death. So you have to have a baseline risk for that. So if you have any high risk factors, it's very important that you stay up to date with your COVID vaccine. So high risk factor, and I would say the majority of Americans have some high risk factor, being obese or being overweight or diabetes or cardiovascular disease, being pregnant. Many risk factors fall into that category that put you into higher risk for COVID. So those people need to be mindful of when new vaccine formulations are developed or when they're due for their next vaccine. For lower risk people, I think everybody should have gotten the initial vaccines to have some baseline immunity. And I think children, when they reach 6 months of age, should get the initial series as part of their routine childhood immunization. After that, if you're lower risk, I think the benefit is marginal with these current first generation vaccines. We may get better vaccines in the future that give us more benefit, but I think in that sense, I think that the vaccine in general should be targeted to high risk individuals, with the exception that children who are who reach 6 months of age should get the initial series. And I think that's kind of a general consensus that many other countries have kind of come to, like Canada, like the United Kingdom, like Australia. In the United States, we've kind of had this universal recommendation, which again, I think is an area where there's been some mistrust with public health because, a blanket policy of saying everybody should get vaccinated, that's very easy to implement. The messaging is clear, but it kind of misses some of the nuance. And then when you miss the nuance, then people can say, look, public health is being overly broad, or they're making a one-size-fits-all solution because they don't want to deal with they're not addressing all of these real issues. So that's why I think targeted vaccination with the additional doses and the addition of making sure that children get their first doses and pregnant women are vaccinated during every pregnancy, I think that's the ideal strategy in my mind based on the data.
Mm-hmm. A friend of mine recently became pregnant with her second child, and she's terrified that she's not going to be able to get the COVID vaccination because there's recent conversation around them almost making it unavailable. And do you think a lot of that is fear mongering? And this is just a question that it just came to me. I want to ask you your expertise. I mean, I know the answer. I think I know the answer, but is a lot of this rhetoric that they're having right now that they're going to make so many changes and implement so many things that like we have to do this and we can't do this. Is that going to happen? Is it really going to happen that they're going to be able to tell us that we can't get vaccinations that we want to have?
There's no way for them to prevent you from getting a vaccine if you want it. What they can do is make it more difficult in the sense that when the CDC makes a recommendation, that will often trigger insurance coverage for that vaccine. So if the CDC drops a recommendation for a certain group, then certain insurance companies may say, well, okay, we're not going to pay for that. So then you just have to get it out of pocket, which means it's still available to you, but you're going to have to pay for it out of pocket. And each insurance company may treat these differently. So one insurance company may say, yes, it's covered. One may say no. So it does make it something more difficult. And I think it's reasonable for people to be confused and scared right now because you have, basically an anti-vaccine activist doing all kinds of damage to the vaccine system. Mm-hmm. So it's reasonable that they think that this might completely go away, or they don't understand all these nuances of insurance coverage versus a CDC recommended vaccine. All of that's something that you don't want to have the general public having to wade through all the time, because what you want is it to be simple and easy so that they know how to get the vaccine. They know if they're at high risk or they don't know if they're at low risk, and they have pathways to get those vaccines. What's happening now is that RFK Jr. is sort of circumventing that process and kind of dictating things by fiat, just basically based on what his whim is. And that makes it really challenging for people who are trying to navigate, like your friend who's pregnant, because there's going to be people that will say he's trying to take all vaccines away. And in one sense he is, but in one sense, the other sense is that maybe it might mean that you have to pay out of pocket, or and it's even more complicated than that, because RFK Jr. says pregnancy is not a high-risk condition, but the FDA says it is a high-risk condition, and the CDC says it's a high-risk condition. So this hasn't all been sorted out, but it's exactly the opposite of what you want. You want clarity. You want uniform standards, and that's not what we're getting. He is a chaos agent in general, and that's what's happening.
Oh, yeah, chaos. Perfect word, perfect description. So when we're talking about trust, misinformation, public response, how can public health experts rebuild trust in science and institutions after the erosion we saw during the pandemic?
That's one of the most challenging questions that I get asked, and lots of people get asked, and nobody really has the exact answer. What we know is that trust is broken, and a lot of that trust has to do with the way COVID-19 was handled, and I think that's primarily a failure of government and policymakers who were unable to implement the appropriate public health interventions and really didn't listen until it became too late, and then they had blunt tools, and that eroded all this trust. But I think one of the ways to do it would be to be very clear to the general public when you're dealing with an infectious disease. Don't try to simplify the message or oversimplify the message. Put the nuance in there. Say, this is what we know now. This is how certain we are or uncertain we are of this. These are the questions we're trying to answer. And depending on those answers, the guidance might change. You have to really be clear with people that, science is a process. It's not like 10 commandments from on high that they don't change. You're going to be learning continuously, especially like during COVID when you're dealing with a novel virus that was never known to humans before 2019. You're going to learn new things. And when you learn new things, the guidance might change. You're going to apply what you knew about, for example, the coronavirus family of viruses ahead of time. But when you find this virus, the one SARS-CoV-2 that causes COVID-19 behaving differently, that may change your guidance for masks or your guidance for who's at risk. And you have to be clear that you're still trying to figure these answers out. And sometimes public health individuals and public health leaders can be heavy-handed. They may say, this is how it is, and they don't want to put in those hedges saying, well, the data may change, because they think that somehow dilutes the message or makes it weak.
Absolutely. Yep.
But that's the wrong way to do it, because I think it then breeds mistrust, because then they say, oh, they flip-flopped or whatever it might be. But you have to just kind of put that nuance out there. And I think I think at least the rational elements in the society, as many of them may not be much of it that's left, but those individuals will understand that you're trying to cope with an evolving situation, and some of that data is going to be influencing. As the data accumulates, you're going to get more certainty or uncertainty about certain assumptions you were making. And I think it's just, you need to put that on the table out front, so that people can't say, that you don't know what you're talking about, or we don't trust you because you said this last week and now you're saying this week.
It's interesting to me that people are so judgmental when it comes to stuff like that, because in life, that's just life. I mean, anything you do in life, you might start learning something new and then recognize, well, it's not working, but I'm going to try it this way instead. I don't know. To me, that's just life. And I don't understand why they're not respecting the science. But, you are often vocal in media about misinformation. So how much damage do you think it has done to the vaccine effort, and can it be reversed? All this misinformation that's out there, and you're fighting that battle. You're giving the information. I mean, that's why I'm so excited to have you on, because you're in the arena, as Brene Brown says, right? You're in the arena, and this is what you do for a living. So how can we, how much of that damage that has been done, and can it be reversed, essentially, is my question for you.
There's been tremendous damage. You can think about the hundreds of thousands of people that died during COVID who could have been vaccinated. So that damage is incalculable. People right now in the United States, we've got 1,000 measles cases in multiple different jurisdictions all over the country. That's because of the anti-vaccine movement. So the damage that they've done is incredible and very hard to calculate. Can it be reversed? I almost think that it has to get, and this might be cynical, that people have to see it with their own eyes, and then they come back and say, oh, this is why vaccines are valuable. So you can already see that in places like Texas, where we had this major outbreak of measles, that vaccination rates went up when 2 children died in Texas. Then people say, oh, vaccines are something valuable. There was a reason why that doctors were recommending vaccines. So sometimes I think they have to see with their own eyes. That being said, people saw that with their own eyes with COVID-19 and continued to be in denial or evade the value of the vaccines. I can remember taking care of patients who were dying, and I said something about being vaccinated, and they were adamant that wouldn't have changed this, even though that was completely the opposite of the truth. But in general, I think when people understand that vaccines have this value, not just to check a box, not just so that you have the highest vaccination county, or not just to please a politician, but because it actually helps you, the individual, navigate life or keep your family safe or be able to go to work or have a less disruptive respiratory virus season. When they see that as a value, then I think they get vaccinated. And I think it can come back. I think that the truth always wins eventually. There may be some time period where it's not winning for a long time, but in the end, I think people do come to the truth, because reality ultimately wins the day. And I think vaccines have been proven objectively to be something that's valuable to human life, or part of human life. You think about our human lifespan, decades of our human lifespan, it's now 70 something plus in the United States, are due to the fact that we get vaccines and don't die of childhood illnesses. So all the data is on our side, and eventually the data will win, but we might go through a period where like we are in now, or worse than we're in now, with the rise of vaccine-preventable diseases before people are able to kind of see the truth again.
I mean, we're so early in this administration. I feel like it's going to get worse before it gets better.
Yes, I think that's probably a reasonable assumption, and many of us in the field are dreading if there is a major public health or infectious disease emergency that occurs, because we won't see Operation Warp Speed again. We will see a full-scale disinformation campaign. We will see vaccines not being the solution. Just think about it. RFK Jr. does not even believe in the germ theory of disease. So if you don't believe in the germ theory of disease and we have an infectious disease outbreak, what tools is he going to have if he rejects the very basis of infectious disease control, which is that microorganisms can cause disease? So I think a lot of us are very nervous if the United States is tested again with an infectious disease emergency with this current administration in place and the anti-vaccine advocates in such positions of power.
Because Trump was in office when COVID-19 first came out. Because it originated in November 2019 in China. So that's obviously why they called it COVID-19. But it wasn't until that next March that we went into quarantine. And again, correct me if I'm wrong, but what I was reading in the news that he was like, it's not that big of a deal. It's not real. It's not really going to be an issue.
Yeah. COVID-19 likely began in fall of 2019 in China. It was first reported, though, to the World Health Organization on December 31st, 2019. Okay. In the early days, when this was becoming an issue, Trump was in the middle of a trade deal with Xi, the head of state of China, and I think he did not want to bring up COVID at that time because he did not want any kind of criticism of China to derail the trade talks that were going on at that time, and he was actually praising Xi for how things are being handled in China. At the same time, China was nailing people into their houses because of COVID-19.
Wow.
So he was praising them, and he was overly optimistic, saying it's just a few people, it's going to go away. China's handling this really well, and it took him some time to actually recognize the severity of what was happening. I think particularly telling was when he saw, I think, one of his hometown hospitals, the Elmhurst Hospital in Queens in New York, get engulfed. And then he started to take it seriously. But by that time, if you give a respiratory virus that's efficiently spreading all of January, all of February, and half of March to do something, what do you expect is going to happen? Basically, it's uncontainable. And you saw hospitals in New York City on the brink of collapse because of their capacity. And then you saw, nursing homes decimated, and you saw massive panic from governors all across the country because they didn't want to repeat New York. But the fact is, we didn't have to do that. If you would have been proactive in December or January or even February, fortifying nursing homes, making sure there was enough personal protective equipment, making sure hospital preparedness was in place, making sure we had the ability to test. Remember, Donald Trump said, the more we test, the worse we look. When the exact opposite is you want to test as much as possible so people know their status, so you can know where it's spreading, you can understand the epidemiology. He did all of that wrong. And then in March, governors were left with really poor decisions and very blunt tools because we wasted all that time when precision-guided tools could be used. If you look at a country like Taiwan, they sprang into action December 31st, 2019, and did not have to use these very blunt tools like shutdowns and lockdowns. They were able to handle it and meet cases as they came. They were able to test. And the other great story is South Korea, where they were testing thousands of people in a day back in March of 2020. In the United States at that time, we were testing hundreds in a week. The exact opposite.
Yeah, I'm trying to actually remember when I got tested, because it was middle of March that we shut down. I lived in Boston at the time. So obviously I was in a big city, and thinking, 2 weeks, right? That was the talk at first whenever we shut down, that it was just going to be 2 weeks. Social media platforms were the battlegrounds for truth versus conspiracy. Do you think the tech companies are doing enough now to combat health information?
I think it's a very slippery slope when you have tech companies doing this. I think that these are these are platforms. They have their own rules of engagement, and I'm of the belief that that they should be able to set the terms. And if they want to have fact checking, if they want to do that, they can. What I don't like is when, for example, somebody would write something or there would be a post that was, a disputed fact in science, meaning that there's some scientists that say, maybe this is maybe this is the case, maybe this isn't the case. And then it was getting flagged as disinformation, or the Biden administration was calling Facebook and saying, you need to take that post down. I don't want that to happen. But I do think that tech companies, it's in their interest to have accurate information out there. But I don't want it to be overly, policed by government or politicians calling up Facebook or X or whatever platform and saying this needs to come down because it's not what we want. I don't think we want that. We don't want that. Yeah. And that's why I think it's a very slippery slope. And I think there can be better policies that social media companies can themselves initiate, but I think that you want to have it not be kind of overly proscribed is how I would put it. I don't have an easy solution to it though, but I mean, it's the same thing that you have to deal with in the newspaper or the letters to the editor page. What types of things do you print? And there's going to be, if you read a letter to the editor in the Butler Eagle, there may be falsehoods in it that aren't caught because it's, quote unquote opinion. And you have to, there's this slippery slope that I think it's hard to really navigate.
Yeah. Well, because at that time when it all came out, that's what we were relying on. A lot of us were relying on what was online, what we were being told. We had no idea what to think moving forward. And, talking about emerging threats, preparedness, are there new or overlooked infectious diseases that keep you up at night? And what should we be watching out for in the next decade?
So I think if you talk about pandemic threats, avian influenza is the highest pandemic threat. And I would have, if you were doing this interview with me in 2007, I would have said avian influenza is the highest pandemic threat. The 1918 pandemic of flu was an avian influenza virus. So there's lots of different avian influenza viruses. There's a couple that are in the news right now, like H5N1, which are causing outbreaks on dairy cattle farms, as well as poultry farms. But there are dozens of avian flu viruses that, under the right circumstances, could have the potential to spark the next pandemic the way 1918 did. That's the most pressing threat, which is why the cancellation of the Moderna contract for avian influenza mRNA vaccines is so dire, because that's one of our best tools to be proactive. So avian influenza, I think, is something people should always be on the lookout for. The other thing to keep in mind are, there's many different infectious diseases that are spreading all over the world. So we live in a very globally connected world. I'm talking to you now in Butler, Pennsylvania. I could be in Africa tomorrow. And so diseases travel now at the speed of a jet plane, not the speed of a train or the speed of a steamship. So things can get from one side of the globe to another side of the globe very, very quickly. So any kind of threat that occurs in one part of the planet can be a threat in another part of the planet within 24 hours. So that means kind of everything has some level of threat. So avian influenza, I would say, is the top. I would also keep in mind something that's kind of a simmering threat, antibiotic resistance, that we overuse antibiotics incredibly. Right now, as we're speaking, probably in the hospitals around and the urgent cares around Butler, people are getting inappropriate antibiotics. That leads to drug resistance. And we are increasingly in a situation where we have no drugs or not enough drugs to treat infections that are occurring because they're being caused by drug-resistant bacteria. So that, I think, is a longer-term public health threat, one that is slower. You don't see it the way you see, a pandemic or an epidemic, but it is something that's important to keep in mind. And we also have more mosquito-borne illnesses, things like Zika, dengue fever. Those things are still occurring. Certainly in Western Pennsylvania, there are many tick-borne illnesses that are still pressing problems. So, but the point is that there are many different infectious disease threats, and it's hard to keep abreast of all of them. But in general, this is why you want a good public health system. This is why you want infectious disease physicians to do all that work for you. So you know what threats are out there. The way the weatherman tells you it's going to rain today or there's going to be a tornado. You want to be able to think about infectious diseases that way. And that's what expertise does. Helps you learn how to risk calculate in a world in where there are going to be infectious threats on one hand. On the other hand, you have to live your life. You have to interact with people. You have to do things. You want to go hiking. You want to go to a concert. You want to go places where there's going to be infectious disease threats. People need to know those threats and understand them and then make informed decisions. And you have to have a system in place that when infections take advantage of these social interactions or take advantage of whatever situation it is, that you have the ability to respond appropriately or respond in a way that mitigates the damage.
Mm-hmm. I got COVID-19 in 2022 and ended up in the hospital. And I have asthma, so I don't know if that exacerbated it, made it worse. It was awful. I was at home and started having a coughing fit and couldn't breathe. And it got so bad where I physically got sick, like I threw up. And around my mouth and my eyes, it was black and blue. Like it broke so many blood vessels from just that one time because I couldn't breathe after I got sick. And I came to find out where I was living at the time that there were kids who had been in the house who had COVID, but no one told me. And that was a lot of the conversation when it first came out. There was a lot of people who were saying, do this for other people, right? You've talked about that a little bit, is getting vaccinated, wearing a mask, isolating, doing all these things for the greater good for everybody in the world. And there's a lot of people that just don't, I don't know, they just don't get that concept, I guess. And they don't understand, well, why do I have to get vaccinated if I want to continue working here or doing this? I mean, when you're in healthcare, obviously getting vaccinated is probably the most crucial thing that you could do, especially during a pandemic. We're talking about the preparedness, so what lessons from COVID-19 have actually translated into real improvements in our healthcare system, and where are we still dangerously vulnerable? Some of these things I know you've probably touched on.
So one thing that I would say about getting vaccinated and the relationship with others is you don't have the right to infect other people with a dangerous infectious disease. And that's what COVID is to a high-risk person. Mm-hmm. So you need to consent. They need to consent to that. So you need to tell them, I'm sick. Do you want me to come over? That's just etiquette. You can't, some of the basic public health laws that have been on the books for a long time are about infecting people with contagious diseases. That's why we have quarantine laws, because you can't just give somebody tuberculosis. There's consequences. There's certain diseases are innocuous, so you don't worry about, like the common cold. But COVID in 2020 to approximately 2022 or so wasn't as innocuous. So you needed to really think about who you were around and spreading it. The United States was the most prepared country for COVID-19. In terms of infectious disease threats, it was ranked number one because we had the best toolbox, the best scientists, the best technology. But that doesn't matter if you don't use it appropriately. Mm-hmm. So that's why we had one of the worst outcomes, but even despite having the tools, because we didn't use them right. So the lessons from COVID-19 are not surprising. I think we all knew what to do, at least in the field. We knew what the correct actions were. They just weren't done because politicians and policymakers had to make those decisions, and what decisions they made were too late and panicked and wrong. But we are seeing more interest in, for example, respiratory etiquette, people staying home when they're sick, people using Zoom instead of going in person to something when they might not be feeling well, people wearing a mask when they're sick. That doesn't happen a lot, but it does happen. People using home tests, like we have COVID home tests, we have flu home tests. Mm-hmm. People use those to understand their status. We've seen people really thinking about air exchange in buildings. So there is this healthy building movement that indoor air quality really impacts infectious disease transmission. So if you can increase the number of air exchanges per hour in a room, or have certain level filters that are filtering the air, or even just opening a window, that those kind of healthy buildings are less likely to spread respiratory illnesses. So we are seeing that kind of that kind of change happening. I would say it's patchy, mm-hmm. but in general, it is something that will probably be one of the cascading impacts of the pandemic, is that people start thinking about all of this in a way that they didn't before.
Yeah, I know I can speak to here is that we do have that understanding and that support that if you're sick, stay home. Like, they don't want you coming here. They want you staying home. If you need to jump on Zoom or catch up over a phone call, that's always supported. And that's one of the things I do love about working here, is that I'm able to recognize that. And I think since COVID, just a little bit more alert. I've had COVID tests. I think I've taken 2 of them in the last year because I was so sick. Okay, I'm just going to go to this question because I've been eager to ask you this. So how prepared are we really for the next pandemic, and how does vaccination readiness factor into that preparedness? You've answered the vaccination preparedness. I mean, that's just a no-brainer, but are we really prepared for the next pandemic? I mean, when you talk about avian influenza preparedness and, a role that the mRNA vaccines can play, it's scary to think that we still have a lot of people that are not only against vaccinations in general.
I don't think we're very prepared. If you think about it right now, who would be the lead person? RFK Jr. He would be our response official. Do we have a CDC director? No. Do we know who's even running the CDC today? No. The HHS secretary, RFK Jr., wants to reorganize the whole department, but that's all caught up in courts. Nobody knows their roles. We're basically blind right now when it comes to avian influenza on farms. So I don't think we're prepared at all if something were to happen today. Do we have great tools? Yes. Are they being used appropriately? No. So no, I don't think we're prepared, and I think we're worse off in many ways than we were with COVID-19, because infectious disease response is now a political action. It's not considered, a public health function or something that you're doing as part of, national security. This is now all embedded into our politics, and that's going to only, make preparedness worse.
Yeah. So as someone who's from Western Pennsylvania working on global health threats, how did your early experiences shape your approach to science and public service?
Both my parents are physicians. They're both retired, but they're from the Butler area. So I grew up around medicine, and I was very fascinated with infectious disease from an early age. I had this book about Louis Pasteur and the discovery or the development of the rabies vaccine called The Value of Believing in Yourself, and I was obsessed with that book as a child. And that was something I thought was really interesting to me, that there was these viruses and that there were these antibodies and there was this battle that goes on inside humans, and that there were ways to think through these problems and find solutions to them. So that was interesting to me. And then I was born in 1975, and in the early 80s, HIV and AIDS came onto the scene, and we were getting educated about it in school. And I don't know, I can remember thinking someday I'll deal with this virus I don't necessarily think I always wanted to be a doctor, but I had this idea that if I was going to be a doctor, I wanted to do infectious disease. I thought things like the Louis Pasteur book, the HIV/AIDS experience, as well as being kind of very interested in detective stories, things like Sherlock Holmes, who was modeled after an infectious disease physician. That always fascinated me. So I think growing up here in Butler in Western Pennsylvania, all of those things were things that were circulating in my mind. But I was kind of torn between medicine and other things. But I knew that when I made the decision to become a physician, that it would be infectious disease, and it wouldn't just be seeing patients, it would be dealing with infectious disease as a societal problem, because all these other interests that I had all intersect with infectious disease. If somebody, think about other specialties of medicine, somebody has a heart attack, that's one heart attack. If someone has a case of smallpox, that's a national security emergency for the entire world. So that, and as we just saw during COVID, an infectious disease outbreak involves not just the medicine and public health aspects, but politics, economics, finance. It touches education. Every aspect of a person's life, is every aspect of societal life. That to me is really fascinating, and that's kind of why I work at the Johns Hopkins Center for Health Security, where I'm constantly thinking about these policy implications and how the cascading impacts of an infectious disease will affect every aspect of human life.
So what would you say to young people in small towns, so let's just say a young person in Butler, who want to get involved in public health or infectious disease work?
I think it's something that would be very noble. I think it would be something that's endlessly fascinating. It's something that you'll always have something to learn. You never stop. Even today, I learn new things. It's not something that is static in any way. And I would encourage them. And in Butler, particularly, just to highlight some things going on, particular to Butler, is that Butler High School has an epidemiology program. One of the only high schools, or maybe the only high school in the country that I know, that has an AP epidemiology program, which I've had a small little part in, meeting with the teachers and helping them think through some of the curriculum challenges. So Butler is a great place to do that. And I would also tell them to reach out to me. If you're from Butler or from Western Pennsylvania or anywhere in the world, I'm happy to talk to students about ways to think through careers in public health, careers in infectious disease. But I particularly wanted to highlight and give credit to Butler High School for putting together that epidemiology program. And there's some very, very talented and dynamic teachers there that have put that in place. And I think the Butler Eagles actually profiled that teacher recently.
Yeah, that's cool. I mean, you're a Butler High School 1993 graduate, so that's a cool program. How long has that been there? Do you know?
This is the first year they've had the epidemiology course.
Okay. Very cool. So has your perspective on local versus global health shifted over time, especially after seeing how fast things like COVID can go from isolated to everywhere?
So there's not really such a thing as a local outbreak because there's always going to be some implication because people travel. As I said, you can be in Butler today and Kinshasa tomorrow. So it's not something that you can really think about as local. You want to deal with things locally before they spread more and become dispersed. But every outbreak, it has the implications to spread because people travel, and there are airports, and there are train stations, and there are bus stations. So when you want to be adept at dealing with infectious disease outbreaks, you have to have very strong local health response because you want to be fighting it in the early days when there's only 10 cases, not when there's 100 cases or 1,000 cases or 10,000 or a million cases. So that's why local and state public health is very important. They're the first ones that get notified, and working with them to understand what happened, how people got infected, what the source was, and to contain it at the origin, that's always what you want to do. So I don't draw that. So local versus global, it all derives from local because outbreaks have to start somewhere. And maybe that's something similar to you in a newspaper situation, that local news, everything happens in a given location. Archduke Ferdinand gets shot in a town in Bosnia Sarajevo, and you get World War I. So things can cascade out. So you want to be, local is where it sort of happens, where the actual, first jump of something into a human will occur, and that's why I think it's very important that we have very strong public health preparedness at local and state health departments.
I watched that movie Contagion, and you mentioned it, and I thought of the monkey, right? Because there's a monkey in it. And the very beginning, isn't that how it kind of starts?
Yes, at an exotic restaurant where where a person is handling a monkey, and there's exotic food there, which is one way that we get many infectious diseases is through animal interaction. And not just exotic animals, other animals as well, even domestic animals.
Yes, dogs, cats, yeah.
Dogs, cats, cows, whatever it might be, can make you sick. So our interactions with animals are one major route that infectious diseases find their way into humans.
I recently saw a video that popped up of a young man in the United States who was dying from rabies, had been bit by a dog and didn't get treated because was against vaccinations, was against antibiotics. And I wanted to ask you if you know the answer to this. He was strapped down. Is that a typical protocol once someone reaches a certain stage of being infected with rabies? And obviously that's not something like here in this country. We talked about that. I had a friend who went to her master's program for public health and spent time in Arusha outside of Tanzania. And the first thing she saw was a 10-year-old girl die from rabies. It's because they don't vaccinate the animals there. We're talking about a probably more third world country. What's happening? They don't have access to the healthcare that we have, which you've spoken to. But is that normal that someone would be strapped down to a table?
Yeah. So a couple things. So I've been to Arusha. I know there's lots of stray dogs there. It's very difficult to vaccinate, and rabies is still a major global problem. In the United States, we don't get rabies from dogs. Our dogs has basically been eradicated in dogs, but we do see rabies in cats, raccoons, skunks, and bats. Bats are the natural host. Rabies is an infection of the brain, of the central nervous system, and it causes what's called an encephalitis, meaning an inflammation of the brain. And think about a rabid dog, or just the caricatures of a rabid dog, maybe Stephen King's Cujo or something.
I was just going to say Cujo.
That's a dog that is furious. They call it, rabies is sometimes called the furious rabies, that the person's brain is infected, is abnormally functioning, and the virus has changed your behavior in such a way that it wants to create an opportunity to get into another person. So it concentrates in the saliva. That's why a dog bites. So rabies in a human, humans don't bite each other usually, but what happens is your brain is malfunctioning. You're becoming very agitated. You're becoming you're not yourself, almost, you're in an altered state. So they can become very violent. They can become completely disorganized with what they're doing. So sometimes that might involve having to restrain them or sedate them to do that. Thankfully, rabies is not very common in the United States because we have a lot of our domestic animals vaccinated, and we have quick and ready access to rabies immune globulin and rabies vaccines, but that's not the case in many parts of the world.
Yeah. And it's interesting to me that someone would refuse care when it's 100% treatable, right? Once if you're bitten by a dog, or let's say a bat, or, a cat or a raccoon that you potentially could have rabies, you go to the doctor, you go to the hospital, and you get treated, and it's preventable.
Yes, you should not be seeing rabies deaths in anywhere that there's easy access to the countermeasures. There are sometimes people that don't know that maybe they woke up in their room a bat was in their room and they didn't notice it and got scratched or got bit by a bat and not notice. Or there are people that might be maybe hiking in Nepal or somewhere and get bit by a rabid stray dog, and then they can't get to the treatment center fast enough. So there's some issues. You need to be quick. The quicker the better, but you have a window of time once you've been exposed.
Okay. What is that window of time? Do you know? Like if you were to...
It all depends on where you've been bit.
Okay.
The window is much longer if you were bit on your toe versus bit on your face, because the rabies virus is very unique. It travels along nerves, and it's trying to get to your brain. So the farther it away from the brain is, the longer the incubation period is.
Okay. But either way, just go.
Yes.
So vaccine equity was a major issue during COVID. So are we making real progress in making vaccines more accessible globally, or have we reverted back to rich countries first?
It's interesting because anytime there's going to be an infectious disease emergency, any politicians in a given country are going to want to vaccinate their own country first. That's what they're elected for. That's what they think. And that happens no matter where it would be.
Okay.
So that's one thing, is the politicians. So in the United States, it wasn't as if Pfizer and Moderna weren't trying to get vaccines other places. Both President Trump and President Biden put export restrictions. So it wasn't as if the companies, Pfizer and Moderna, weren't willing to give vaccines or sell vaccines or do things. It's if these vaccines cannot leave the United States because there's an export restriction. So a lot of that vaccine inequity that you hear about had to do with government officials saying, you're not exporting anything, and we're going to vaccinate everybody in our country, both doses and a booster, before we let you do, which made no sense. But that's what happened, because politicians are elected not on how, they're really worried that their constituents are going to be left out or hold them responsible. So that's one of the problems, is these export restrictions. But we have seen a big push to have domestic manufacturing of vaccines and countermeasures in other parts of the world, like in Africa, like in parts of Asia, so that you don't have one country dependent on exports that could be restricted by the president. So it is getting better, but I think you'll always kind of see some level of kind of vaccine nationalism, because vaccines are going to have to be made somewhere, and that there's going to be this kind of protectionist thing that we want to make sure we have ourselves covered first before we give anything. And it went overboard it definitely went overboard in the United States, and I think it was something that the vaccine companies got blamed for, but it was, if you really dig into it, you'll find that there were government export restrictions that were playing a major role. Well,
that's good to know. Thank you for clearing that up. There you go. Anyone who's questioning. So I feel like I kind of asked you this. There's been debate about personal choice versus public good in vaccination. How do you view this tension, especially in the context of American values? I sort of asked you this question a little bit, but if you feel like you have more that you could say on that.
Vaccines need to be a personal choice that an individual is choosing to get vaccinated, but recognize that what choice you make is going to influence how others treat you. So if your employer requires you to be vaccinated and you decide not to be vaccinated, that's your right not to be vaccinated, but it's the employer's right to say, we don't employ unvaccinated individuals. Or it's the right of the school principal to say, we don't enroll students who are not vaccinated. So if you choose not to vaccinate your child, so just be ready to deal with the consequences if it is your personal choice. And also remember, when you're choosing for somebody else, like a child, and your child gets measles and is hospitalized, that you have the moral blame for that. So also be ready to live with that. And you don't have the right to endanger a child. I would also put it that way. So certain vaccines, if a child has an untoward outcome, like they get a severe case of measles or a severe case of whooping cough or whatever it might be, I think the parents are morally culpable for that.
Mm-hmm.
So I think that it is the case that you have a personal choice to get vaccinated or not, but also you have to have a personal responsibility to live with that consequence that people may not want to associate with you because of that. And other people have a right to be safe from other infectious diseases. And if they don't want to deal with an unvaccinated person, that you have to respect their right. That's their personal choice.
Mm-hmm. I don't know if you ever have the time to watch television. Do you watch Grey's Anatomy or The Pitt, or have you heard of The Pitt? It's the show that's based out of Pittsburgh.
No, I watched The Pitt. I did my residency at Allegheny General Hospital, which is kind of the setting of The Pitt. So I watched The Pitt. Grey's Anatomy, not so much.
Okay. I know Karen was telling me that a lot of the stuff on Grey's that's not how it is. That's not how it is. But she's like, yeah, it's a guilty pleasure. But I watched The Pitt, and there's a very specific episode where a young boy comes in. His sister has had measles, but he contracted from her, and they're not able to treat him because unless they do a spinal tap to determine whether he does have measles or he has something else, if they give him the wrong medicine, it could kill him. And the mother primarily is so adamant, no, he's already looking better. And he's completely unconscious. I believe he might have been intubated, perhaps. I can't remember if he was at the time, but a situation like that, have you ever, obviously without giving any details, have you been in a situation like that ever where you're legitimately trying to save someone's life and you're like, I can't do anything more for you right now unless you let me do what I need to do as a doctor?
I mean, that happens all the time where a patient, you need another test and the patient doesn't want that test, or they sign out against medical advice. Yes, oftentimes you are stuck with a diagnostic dilemma and a patient isn't agreeing with the diagnostic pathway you're going on. And it might be because they are scared. It might be because they have something else to do, or they don't understand what's going on, or they think it's too much. Or yes, that happens all the time. And the job of the physician is to really lay out the risks and the benefits of the procedure and talk about why that information is necessary. Mm-hmm. Not that you're doing it just for fun or to pad the bill or whatever they might think, but you're doing it because you need vital information from whatever test or diagnostic pathway you're going down. So that is a challenge. It's always a challenge to take, science and apply it to a person in front of you, because it's not, sometimes I say it's like a video game when you're working on an electronic medical record in a hospital, but it's in a way it is, but in a way it's not, because you've got a real patient on the other side of that you have to try and do right by.
So looking forward, what role do you think vaccines will play in the broader conversation about climate, migration, and global instability?
Well, I think that vaccines are part of making all of those things safer for us. So as climate varies, certain diseases become more prevalent, certain diseases become less prevalent. So we have vaccines that can help prevent diseases that are tropical, for example, like yellow fever or chikungunya, whatever it may be. Migration, moving from one part of the globe to another, there's lots of vaccine preventable diseases we want to make sure people are vaccinated against, because vaccines might not be so accessible in parts of Africa and parts of Asia. So vaccines are something that make all of those things easier to do, easier to accomplish, make them safer. So I think vaccines play a major role. As I said, they're a civilizing force. They make it very easy for humans to live. And I think so whatever we do, vaccines play some role in it, making it easier, safer, more efficient, whatever it might be. They're always going to have a major role, because they're a piece of technology that allow humans, and I said this before, to flourish, to be able to live in a world where there's lots of microorganisms and lots of infectious disease threats.
Well, Dr. Adalja, thank you for your time today. Is there anything else that maybe I didn't cover or ask you, or you feel like you want to leave us with?
I just think it's important that people are aware of infectious disease. We went through COVID-19 just like people went through 1918, 100 years prior. And I think we want to not let these lessons be buried. I think people know what infectious disease can do to society. And the thing is, we have more tools than we ever had. The key thing is making sure that we use them. And I think that people should hold their policymakers to task for this. And that's policymakers at all levels, from the president to your school board member. They need to have a plan for infectious disease threats.
Well, thank you. I was so nervous about this interview because I know how well spoken you would be, but you are on television. How often would you say you're speaking on television?
Probably maybe 3 to 5 times a week. Not like during the height of COVID where it was 30 times a day sometimes. But
Oh, wow. Okay. Well, thank you. I appreciate you. Thank
thanks
you.
for having me.
Yeah, you're welcome. Thank you for tuning in to Alter Eagle. Join me every Monday for a new episode, and be sure to click subscribe so you don't miss a single episode. Follow us on Instagram at Alter Eagle Podcast. Until next time, stay safe, stay hopeful, stay kind.